Hi, this is Dr. Tenner here at the Goldberg Clinic for Chronic Disease Reversal, located in Atlanta, Georgia. And today I'd like to present an interview with a patient that we've been working with for the past 2.5 months. The patient came to see us all the way from Keller, Texas, and over 50% of our patients actually come to see us from out of state. And internationally, we are a clinic that is uniquely set up to work with patients from long distance. So this particular patient came to work with us with a medical diagnosis of rheumatoid arthritis. We worked with her for approximately 2 to 3 months over the phone and via email. And the following interview is a detailed account of her experience with us here at the clinic and the significant improvements that she has seen while under our care.
Good morning, this is Dr. Paul Goldberg at the Goldberg Clinic. This morning we're doing a re-examination with Rushan Orth, who comes from Keller, Texas. And Rushan was first here to see us in October of this past year. And she came in with complaints of rheumatoid arthritis, which had been diagnosed by a rheumatologist, and also severe headaches. And Rushan has an interesting background. She's been in the military, and now she works in the field of, would we correct to say, veterinary pharmaceuticals?
Yes. Mm-hmm.
Tell us a little about your work. What is it you do with pharmaceuticals?
I actually run clinical trials of pharmaceutical drugs for pets.
For pets, okay. And it's, I mean, it's a very similar field to human pharmaceuticals. You get a lot of similar ones, but of course they have their documented and put out specifically for animals in different amounts, but it's somewhat similar to human pharmaceuticals, isn't it? Very much.
So.
Okay. Anyway, when you came in, you were suffering with rheumatoid arthritis and migraines, and tell us just a little bit about the history of what had gone on with you prior to coming here, please.
Well, initially I was first experienced symptoms in my feet, and there was a lot of stiffness and swelling.
How long ago was that?
It started in February of 2012.
Okay.
So, I thought it was an injury from working in the yard, and then it would progress from one foot to the other. And then eventually it started working where I was seeing symptoms in my hands. My hands would get swelled, I was experiencing stiffness.
Mm-hmm.
So obviously I went to my doctor. And
You went to your general practitioner?
General doctor, yes.
Okay.
And where I was tested for RA and then put on a series of steroids.
So they tested you for rheumatoid arthritis,
Mm-hmm.
which is made, the diagnosis made upon symptoms and signs and certain blood tests such as a RA factor.
Right.
And then they put you on, they put you on prednisone, a Medrol pack of prednisone.
Right.
Okay, and how did that affect you when you went on the steroids?
Well, initially it was just a week's worth just to see if we were ruling out an injury or, something else. And even though that it would decrease the swelling, I still had a little bit of stiffness when I walked and discomfort there. But it obviously did make me feel better.
Right.
With that aspect.
We say at our clinic that, prednisone is one of the most common drugs that we see prescribed for patients. It will suppress almost any type of an inflammatory response. And of course, the body uses inflammation as a general way of dealing with disease. It is also an immunosuppressant, so when it's used with an autoimmune disorder, symptoms go away. But we also talk about prednisone because of the fact that it leads to cataracts, bone loss, adrenal suppression, thinning of the skin, and many other problems, including diabetes, that it's basically enjoy now and pay later.
Correct.
Would you agree with me? You have a background in working with pharmaceuticals. Would you agree with that assessment?
Absolutely.
Okay, so you were interested in addressing the causes of the problem and of getting off the steroids. Right? Can you tell us just a little about your experience when you came to the clinic, and what did we do?
Well, I decided that going with traditional medicine was not my course because I could not even find a doctor that explained what rheumatoid arthritis was. It was more about giving me medication. And I knew that, being in a veterinary medicine, I'm a person who's inquisitive and I want to know why things happen. So, I found you and came here in October and really wanted to just take a natural approach to what I was doing. I know that the body creates this, then I know that the body can get rid of it, and so I was just finding
Yeah, because you
way to
had
get
not
rid of
had
it.
this all your life, you had been a healthy person. This had come about, there must have been some reasons why it came about over time.
Right,
Right.
absolutely.
All right, and tell us just about, I know you have one knee that's particularly swollen, that's your left knee. And we found that that's very inflamed and very warm. So when you came in, we did the usual case history, and it is, as we told you, always true that every patient is different, that if they stamp somebody or brand somebody with rheumatoid arthritis, it's very important to understand that every patient is different, even if they have the same medical diagnosis, because that diagnosis is simply based upon the signs and the symptoms the person has, rather than upon causal or etiological factors. And being a bright lady and an educated lady and an inquisitive lady, you wanted to find out why you were having it. And we did some tests on you along with a history, and we set you forth on a program. And tell us about what happened, because that was you didn't really start the program until about when?
It was December, about almost the middle of December.
Okay, and we're just in mid-February. In fact, it's Valentine's Day today.
Yes.
Yeah. So we just started this program with you fairly recently, and what did that consist of in your case?
It consisted of a little bit, I took off of work for rest.
So
Rest
rest
is important.
was and is a very important aspect here.
Absolutely.
Yeah.
I needed to eliminate the stress in my current lifestyle, so
Okay.
a huge lifestyle change, huge dietary change. I obviously on the go, always working, poor dietary habits, and just a different mental outlook of being able to stay at home and rest and focus on healing were probably the biggest things I had to learn and adapt to.
You know, and rest is such an important thing, even and even on a short periods of a liquid diet, you're not fasting. Some of our patients occasionally will fast, and really all of these things too are also directed at resting the body. In fact, fasting is just what we would call a physiological rest. When we put patients on a liquid diet, is to rest the gut and to rest the immune system. And so I think that you were very wise, and you put a priority on your health, and you've taken off time. And what have been the results? And basically, so far, the main thing we have done is taken all the things that were precipitating and aggravating your problem and just gotten rid of them and allowed you to rest. In just a couple of months now, what have been the results that you've had?
I have more clarity. I have more energy, even though I'm still working on gaining more energy.
Right.
It's you can just tell there's a transformation there as far as the energy that you have. Obviously, I've had some weight loss.
How much have you lost?
I've lost a total of 20 pounds since being on your program, but I was even heavier prior to starting and visiting you as well.
Okay.
So that has been a tremendous help. The swelling has gone down considerably. I still have some areas that I have swelling, but the stiffness in the morning and the evenings is a little better.
How are your migraine headaches?
My migraines are completely gone at this
Completely
point,
gone.
which, if you've ever experienced migraine headaches, that is just a blessing in and of itself, to
That's-
not have to take the medication.
Plus, it's one less stress that we
Yeah.
have to burden you with. Okay, so what we did today with Rashan is that we have done a re-physical, and we're just we're about halfway through here, and we're just seeing what we have to do to carry the process forward at this point. So we're going to rerun a couple lab tests, talk, look at the progress that we've had, and decide what we need to do in order to move forward. And we're going back to Keller tonight, Keller,
Yes.
Texas.
Hopefully,
And I did tell you that I went to school in Texas, right?
yes.
University of Texas, that's right.
That's how I knew you were the one.
That's right. Because actually, after all, Texas is not just a state, it's almost like a nation, isn't it?
It is.
It
It's
is, all right. Rashan, thanks so much for sharing this with
You're
us.
welcome.
And you're halfway through your program pretty much at this point, and we're looking forward to continued progress for you.
Thank you.
Thank you.